in print and radio for being here and getting that pertinent information out. And to our sign language professionals, thank you so much again for continuing to be here. Of course, to my cabinet heads and rank and file and their families who've been tested and true to a number of natural man-made disasters. Thank you very, very much on that. And of course, to each and every one of you, the residents of the city of Springfield and our business community, for your patience, cooperation, and being able to collaborate together as we move to defeat this COVID-19. Your understanding is deeply appreciated. We're getting there. I know it's frustrating, and the fatigue at times sets in, but we need to keep our eye on the ball moving forward. Before we go into the statistical aspects of COVID-19 and some brief updates pertaining to my cabinet heads, I'd like to hold a moment of silence for two individuals. One, Pastor Stephen Williams' lovely wife, Denise, who fought a valiant battle, and to Duggan Academy educator, Mary Ann Fitzgerald. She too fought a very, very valiant battle till the end. Courageous battles they both fought. May God rest their souls. I'd just like to take a moment of silence again for Mary Ann Fitzgerald and to Denise Williams. Thank you very much. Also want to give a shout out, congratulations to my commissioner, or our Dr. Anthony Fauci, too. We got a number of Dr. Anthony Fauci's here with Dr. Kerouac and Dr. Bruce. Helen Colton here. She is also an Urban League Community Builder Award. So Helen, congratulations on that, and appreciate your continued efforts. COVID-19, the total cases since this ordeal has started is confirmed cases, 21,388. The monthly total is 1,782. This past week we saw a slight decline, which is good, 504. We're still technically in the red, so we can not afford to be lax. We still need to follow all the public health protocols and continue to wear our masks where they are deemed appropriate, please, on that. Helen and I continue our efforts for and to expand more open vaccine neighborhood sites. This weekend, Helen and I were at St. John's Church on Hancock Street, and we did our Vax Force. I'm very thankful to the Vax Force members, many of them who were there. Interfaith, the houses of worship, faith in science. We're utilizing them to dispel any misinformation, rumors and innuendos about the vaccine and how important it is to take the vaccine. We believe, and Commissioner Colton will go more into, we either had 11 or 12 houses of worship that were there, and the volunteers. I also want to thank Western New England University. School of Pharmacy was there. Mcas students were there. Caring Health Center was there. And of course, our great partner, AMR. Patrick Leonardo, Director of Operations. AMR was there giving out the shots, and they've been fantastic. You know, when Helen and I continued to push for neighborhood sites, and again with Governor Baker, appreciate his partnership. We wanted the Max site here, which we have we're curative at Eastfield Mall. We said that these hundreds, and then working with our other partners, Bay State, Mercy, Caring Health Center, but on our own, we said that these hundreds of shots would add up very quickly. So with Commissioner Helen Colton Harris and I, the neighborhood vaccination sites that we have done, we are now nearing 10,000 Springfield residents on our own being vaccinated. The convenience and safety for them, and the trust they have in being with officials they know and sites that they know. And when you couple that with curative, I believe curative on Springfield residents, so it's about 38,000. So lo and behold, we're nearly at 50,000. 50,000 Springfield residents that have received the vaccine. So that's about 1/3 of our total population. That's including younger people too. So little by little, we've crawled up those charts. We're going to continue to stay very dedicated to that. The next sites that'll be open, besides the sites we have at Bowling School and other places, 16 acres area, the Greenleaf Prado Concepcion Center, that could possibly be opening up later this week. The Greek Cultural Center in the North Block will be opening up very shortly. Maple High Six Corners, the J.C. William Community Center on Florence Street, that will be opening up very shortly. Oasis Food Pantry with John Foley in cooperation with Sedesco and the Food Bank of Western Massachusetts has officially moved. They started this past Friday up at the Eastfield Mall, the old Sears Automotive Building, which stands alone just before you get to the mall there. So they're there every Friday now. They used to be at Central High School, but every Friday, Eastfield Mall site, the old Sears Automotive Building, and again, they've John Foley and team we serve about 3,500 families a week with nutritional foods there. Governor Baker continues with the Homebound Vaccines. That's through the state. All the information is on the website. If you are homebound and need a vaccination shot, they have a way to facilitate that for you. I know BHN, who we've partnered with, is doing some too. We continue to deliver meals to our seniors who are homebound, and that has gone well. The telephone banks, I was telling Helen earlier this morning, I can't say enough. Health and Human Services crew, the library crew, Elder Affairs crew, Molly Fogarty, Sandy Federico. People tell me all the time how well they feel when they're able to converse with somebody that is able to traverse them through signing up for those vaccine shots, and how comfortable they feel. So you can't put a price tag on that. We continue the curative, the mass vaccination site at the Eastfield Mall with Governor Baker, and that has gone very smoothly. Stop the Spread, again with partnering with AMR and Patrick Leonardo, Director of Operations of AMR. Testing continues at the Eastfield Mall, and that has gone very smoothly. Some basic quick updates. Again, it was very heartfelt. We did another house dedication for Habitat for Humanity at 39 James Street. Anna Castro and family. She's in the medical field, single mom. This is the third house we've done just on James Street. And it was very heartfelt. And you have another good family going into a good house, which strengthens that street and strengthens that neighborhood. Had the pleasure of being with Governor Baker, Lieutenant Governor Polito. We celebrated Earth Day at MGM. Again, a major award that they received, the National U.S. Building LEED Green Award, Platinum Award. So MGM once again shows that they're not only, they have concern for the environment, not just the bottom line of the budget. So congratulations to Chris Kelly and crew, but that was last week. We continued to celebrate Earth Day last week with the MVP grant, and that was Under Secretary Environmental Affairs. Dan Seeger was here, and we forestry, the money we ever received, we're doing our forestry division area to put more trees out and more seedlings with Pat Sullivan and greenhouse that we were able to put up in the old Camp Seco area off Trafton Road, now Angelina Camp Star. AMR, Patrick Leonardo, will be with him this week. Again, the Earn to Learn program. We're deeply appreciative. They are taking residents, and a huge percentage are Springfield residents, that while you're being trained to work for AMR, you're being paid, and you're about guaranteed to receive a job. So it's a win-win-win across the board. So we look forward to doing that, and shout out to Dr. John Santoro too. We appreciate that. We'll be honoring the National Division I hockey champs, Pope Francis High School, I believe this Thursday will be at Pope Francis. Again, that's a first for the city of Springfield, but winning the D1 National Hockey Championship, a hell of a run they had there. Arbor Day comes at the end of the week with Pat Sullivan and Forester Alex Sherman. We always plant a tree. We'll be planting a tree at Bowles School, and this will be in memory of a former teacher there, Lynn Ainsworth, God rest her soul. And of course, I will be wearing that trademark wooden tie made by John Bilodeau of the Parks Department. On the police front, Commissioner Clapper indicates to me that there's only one down with COVID-19. Relatively, I'm knocking on wood, quiet weekend. Our DOJ meetings continue. We'll get another good meeting with Judge Ireland early Friday morning, and we'll be meeting with DOJ again this week. But the big news and the very heartwarming news, because you hear a lot of negativity pertaining to police departments across the country, some brought upon by themselves, other times not. 3 officers, and this is what our men and women in blue do, day in and day out. Not looking for any pats on the back, not looking for any accolades, just doing their job for the betterment of the community. But officers Francisco Luna, Josue Cruz, Luis Delgado saved a 3-month-old baby who was not breathing. Brought that baby back to life. The baby's doing well. I happen to know, found out just late Friday evening, the baby's grandfather too, and he was so appreciative. So again, to Officer Francisco Luna, Officer Josue Cruz, Officer Luis Delgado, from the bottom of my hearts, our hearts, thank you. Thank you. You saved that 3-month-old baby's life, and that's what our Springfield Police Department stands for. Fire Deputy Mike Hess is here representing Commissioner B.J. Calvey. There is nobody down with COVID. It's a quiet week, which is good. It'll be a short report. They continue to move to try to vaccinate more individuals in the fire department, move the percentage up. Pinch hitting for Director Chris Signoli is Deputy Director Greg Superno. He indicates to me COVID-19, nobody down, which is good. Pothole season, and Greg indicates to me, got 311, call 311. We have our crews. They will go out there, please. Street sweepers continue to hit our neighborhoods. Yard waste has continued to be picked up. Again, yard waste is picked up on your recycling day. Yard waste is picked up on your recycling day. Traffic light technicians, again, we still need that. And it doesn't hurt. We're always looking for CDL drivers, though I thank the media. We put the word out, and we've been able to get some CDL drivers to come in. Superintendent Dan Warwick indicates to me the meals that we have served since the start of this COVID-19 coronavirus pandemic now number 7,176,407. That is breakfast, lunch, and dinner. Weekend, we gave out nearly 60,000, 59,261. Schools continue. They've opened up very well. I think the superintendent will indicate to you today that the 7th and 8th graders have started today. Spring sports have opened very well. Again, I want to thank Athletic Director A.D. Dwayne Early, there's Jeannie Clancy, and of course Commissioner Helen Colton Harris and Assistant Superintendent Lydia Martinez. Bless you. On the testing that we've done it very, very structured, very structured in order for our student athletes to continue to play ball. We are going to have Superintendent Warwick, and I know people will be excited by this, we will hold high school graduations. Those high school graduations will be held at Central High School football field, Birdie Field. They'll be outdoor, which will give us more than enough room and we'll have proper rain dates if needed, but that way families can see their graduate cross that stage and receive he or she's diploma. So we are going to move for live graduations. I know people will be very ecstatic about that. We have school committee, our public session for the budget this Wednesday evening, and then this Thursday evening our regular school committee meeting will happen. Another award winner from the school side for the Urban League Community Builder Award, our very own Kathy Mastronati, paraprofessional union president. She's going to get a community building award too, along with Commissioner Helen Colton Harris and Dr. Mark Kerouac. So Kathy, congratulations, and I'll see you at church with your mom at 4 o'clock Mass at Mount Carmel. Finance, CAFO TJ Plate indicates to me since this has started, $8.5 million deficit. Our FY21 deficit is $3.6 million. Deficit in grants, total spending for the residents and business community of the city of Springfield is $37.7 million. Of that, we've been able to pawn off 29.1 to grants. 8.7 deficit is currently being run. We continued our development with the FY22 budget. I'm very thankful to Congressman Chairman Neil Ritchie. He was able to facilitate a meeting for myself and my team, financial team, with U.S. Treasury officials last week. It was very helpful as we look to cross the T's and dot the I's on the federal stimulus package and how the money can exactly be used. Once their rules and regulations come out, we're hoping sometime probably in mid-May, I will roll out my plan of use for that money, much more specific. And then finally, we'll close out presenting our FY22 budget for public presentation, and then to the City Council to do their due diligence once we get the finalized guidelines with the stimulus package. Facilities, Parks, Director Pat Sullivan, who we were with earlier, very early this morning. Pat is covering another deadline for me on grants. Nobody down with COVID. He continues to work hand in hand with Commissioner Helen Colton Harris on opening neighborhood vaccine sites. Forest Park, no issues at all, was packed Saturday. I went by there late Saturday afternoon, and the line waiting on Sumner Avenue to get in there, and it was great. A lot of families there, no issues whatsoever. Of course, we have the Sheriff's Patrol with Nick Kochi and the patrols with Mr. Clapper, no issues whatsoever. Pat continues to work very closely with Superintendent Warwick. Schools have reopened very, very well. Pat, as I said, he's working on some grants that we're getting in deadlines right now. He's very good about going after master plan grants. We still are in need. We're going to try to run summer programs. Lifeguard training started last week. We still in need of lifeguards and summer recreation leaders. So that's all posted on the website. Echo Dev Director Chief Development Officer Tim Sheen indicates to me nobody is down with COVID-19, which is fantastic. The regional unemployment rate is down to 6.7. That's the lowest it's been in quite a while. That's regional. And we'll see what Springfield shows. It has been going down, but Springfield's been in the double, just a little above the double digits. Technical assistance responses for our businesses, which Tim and I said we're going to do. 2 responses came back. We're going to be evaluating those responses so we can continue to help out our businesses, especially our small businesses, that they have the technical expertise available to them, that they can continue not only to survive, but set themselves up to thrive after we defeat this COVID-19. On the law, HR labor front, the Solicitor Pakula and Attorney Mahoney gave me their updates. We continue our DOJ meetings with Judge Ireland. So with that, I'm going to I also wanted to let you know too that we're going to continue with our senior car parades. Helen, I think we have one coming up this week. The camaraderie, you can't put a price tag on that when the seniors come by in their cars. We're hoping to get our centers open as soon as possible, but that's the Ray Jordan Senior Center I believe that's coming up Tuesday, another get-together we're doing. And I think we hit everything. So with that, I'm going to bring up Dr. Mark Kerouac, the CEO and President of Bay State Health Systems. He will be giving a report from Bay State, and also on behalf of Dr. Roos from Mercy Hospital and Trinity Healthcare. And after that, Dr. Kerouac from Bay State will take any questions or comments from the media. Without further ado, Dr. Mark Kerouac. Thank you.
Good morning, everybody. Thanks, Mr. Mayor, for inviting me and for holding these events, and to the media for your continued coverage of this crisis. Our current mini surge is slowly declining in the United States, though other parts of the world are really going strong with COVID. You've certainly heard the news from Brazil and from India. There also has been a surge in Puerto Rico, where they've gone from 200 to 800 cases a day after relaxing some of the public health guidance on the island and welcoming back tourists and having the Easter holidays. They now are in a bit of trouble because they are behind Massachusetts and most other states as far as vaccinations. Across the United States, new case rates have declined. They got as high as 70,000 a day. Now they're in the low 50,000 a day range, so things have been steadily going down. There are some states that still are surging, including Michigan, Florida, Colorado, Pennsylvania, New Jersey, and Maine within New England. Cases are predominantly in younger people, predominantly in the unvaccinated, and the majority virus that's circulating right now is that UK variant. In Massachusetts, our 7-day average has been on the decline, coming down to about 1,100. Deaths have come down quite a long ways, from about 30 to less than 10 every day, and hospitalizations have fallen below 700. So these are all very favorable trends, although they are more marked and more brisk downturns elsewhere in the state. Hampden County is on the decline, but we are still going down more slowly than most other counties, so we're still number 2 as far as the new cases on average per day. Happy to report that only 7 towns in Western Mass are now in that red zone, but they do include Springfield, as well as Holyoke, Chicopee, Ludlow, Hampden, Palmer, and Southwick. Bay State health numbers are holding reasonably steady. They have over the last 4 to 6 weeks, in the 70s. This morning, 78 patients across our system, 59 at Springfield, 19 in our community hospitals, 17 in critical care, a test positivity rate of 3.16%. I noted a story today that that focused on that 17 patients in critical care. Clearly that is an uptick, but it's important to remember that looking at critical care numbers, you're looking backwards at cases that happened 2 or 3 weeks ago. I focus a lot, in terms of being able to predict what's coming next, I focus a lot more on test positivity, and we are seeing a steady decline over the last 2 weeks. We were close to 5% a couple of weeks ago, and now 3.16% is a significant downturn. At Mercy, they've held roughly steady. They've been in the 9 to 16 range for the last several weeks. This morning they were at 12 with 3 in critical care. They too are seeing case positivity rates come down, 4.3%. So both hospitals are seeing that declining test positivity rate, which we're happy to see. Neither hospital has any problems with capacity or staffing, no changes to report in visitation policies or in vaccine operations. Vaccine, as you know, is now available to all adults over 16. The big news of the week was the resumption of the Johnson & Johnson vaccine after an 11-day pause suggested by the FDA. There will be a warning that accompanies the vaccine regarding a clotting problem. Sometimes these are routine, involving the blood vessels of the legs, but sometimes they're more unusual and serious, involving large blood vessels in the brain or in the abdomen. The rate is quite rare, 1 to 2 cases per million vaccinated individuals. It is more common in women 20 through 60, although still pretty rare in them as well, 7 cases per million individuals. There's going to be warning information shared, but the risk is still lower than the risk of dying from being struck by lightning, so it is a rare event. Nonetheless, it's important for anybody getting the shot to be aware of unusual or persisting symptoms after the vaccine, anything that goes on more than a day or two, things like headache, confusion, abdominal, or leg pain. There is a test for this unusual clotting syndrome and a treatment for it as well, so that if you get it, it's not uniformly fatal or problematic. It can be treated. The Johnson & Johnson vaccine also is easier to store, and it's a one and done, so I think it still will have a role in terms of our toolbox for getting the vaccinations out there. It's also worth noting that COVID itself can cause the same kinds of clotting problems at a much higher rate than the vaccine does. In the United States, there have been 140 million first doses of vaccine. That's 54% of adults, 81% of seniors. 95 million people are fully vaccinated. That's 37% of adults, 66% of seniors. The U.S. has hit over 200 million doses administered, which is an important milestone, and they continue to vaccinate at roughly 3 million shots a day. Across the country, there have been reports of people missing their second shot as high as 8%, although in Massachusetts that's not been a big problem. It's important to remember that if you're getting one of those two-shot vaccines, your protection rate goes from 60% after the first shot to 90% after the second shot. So it definitely is worth it as far as protecting yourself against serious disease. Massachusetts has administered 5.5 million doses, 3.3 million folks getting at least one shot, and 2.2 million being fully vaccinated. The rate is picking up steam, which I was happy to see. It averaged 75,000 shots a day last week, and there were a few recent days over the weekend where it was over 100,000 shots a day. Most of the increase is coming from the retail pharmacies. There are now over 800 retail pharmacies that are administering shots. Chances are there's one near you. I'm also quite glad to see more clinics happening in Springfield under Commissioner Carlton Harris's leadership, as well as a site coming online on the west side. As far as Bay State and Mercy go, we continue to be sort of steady with respect to our vaccine administrations. Bay State continues to get 4,500 first doses and second doses of both Pfizer and Moderna. Mercy gets 1,100 doses of Pfizer each week. We also are sitting on, or at least were sitting on until recently, about 4,000 additional Johnson & Johnson shots that were earmarked for Hampden County, and we will be setting up clinics to administer those as well, with those warnings that I had mentioned before. You will be seeing more of our public relations, public information campaign having to do with vaccine hesitancy. These are featuring 3 of our young infectious disease physicians talking about why they got vaccine, and it'll be out on billboards, print, radio, TV. They'll be doing town halls as well. So I'm grateful for them for putting in the time to encourage people. There also has been some very strong data coming out of the CDC of 35,000 pregnant women who have received vaccine with no untoward side effects. Over the weekend, there was some press for Bay State's so-called long COVID clinic. This is for patients who continue to have lingering symptoms more than 8 weeks after infection. We estimate that might be as many as 10% of folks who are infected. And there are things like being short of breath or fatigued or having a rapid heart rate with very minor exertion, dizziness, as well as confusion, memory problems, word finding, etc. These symptoms almost all get better in almost all individuals over time, and there is some early data that getting a single shot of the vaccine may accelerate people's improvement. We are using a multidisciplinary approach for this clinic with individuals from pulmonary, neurology, behavioral health, physical therapy, etc., working together as a team. And if you are having symptoms after being infected that have gone on more than 8 weeks, I would probably recommend you start with a primary care doctor evaluation. He or she may decide to refer you to this clinic. There's also good data coming forward on what happens with regard to infections after vaccination. They are very rare. The data from the U.S., after 77 million folks vaccinated, there were only 5,800 infections. That's less than 1 in 10,000, and only 400 hospitalizations. That's about 1 in 100,000. And even those folks who do get vaccines are more likely to have no symptoms and very low rates of viral shedding, so they're not as contagious. So that's really good. So in summary, the greater Springfield area still is in a red zone, so there is still virus around. As the mayor noted, we are still working to get ourselves over the hump and get to the majority of citizens of Springfield immunized. And I expect that that will happen given the rate we're going over the next few weeks or so. In the meantime, certainly I would strongly urge people who are eligible, which would be any adult, to register to get vaccinated and to continue doing the usual stuff we talk about every week: wearing masks, observing social distancing, and avoiding larger gatherings, particularly indoors. So, Mr. Mayor, thanks for the opportunity, and I'd be happy to answer any questions.
And any questions or comments for Dr. Kerouac, please? All right. Paul, and then what about Paul?
The figures the CDC released last week on vaccine hesitancy show that Hampton County had the second highest rate in the state. Only, it's not large, it's 8.29%, slightly high.
These would be people who said, I'm never going to get the vaccine no matter what, in a survey or something.
Yeah, and it's slightly lower than Bristol County, which has the highest rate. I mean, is there any, what in your view is the reason for that? Why is Hampton County higher than other parts of the state?
One of the first things I guess I would look at would be demographics. We know vaccine hesitancy is higher in 3 groups: African Americans, Latinx communities, as well as conservative Republicans. So those 3 groups, if you have counties that have more than their share, you'll see more in the way of hesitancy. I think that the key thing based on the studies that the Department of Public Health has done is that people want to hear more about the side effect possibilities from voices they trust and consider authentic, which is why we're doing this campaign with diverse voices.
The decision to put a pause on Johnson & Johnson shot, the poll show, the ABC poll that came out over the weekend showed that increased the hesitancy of taking that Johnson & Johnson shot. What can be done to overcome that?
I think giving people the information, the question was about hesitancy for the J&J vaccine itself. I think giving people the information and letting them know that, out of 1 million people who get the shot, 999,999 are going to do just fine and are going to get an excellent level of protection with just one injection. So my hope is that we can focus on the positives of the vaccine versus the risks of getting COVID and being unprotected.
Yeah?
In terms of the vaccine, the Resumption increase in ICU patients that are below the suggested, is there any sense of are these increased in ICU patients, are they coming more from the community hospitals in, or are they starting from patients that are either walking into ER or are in a regular hospital or is in Springfield?
Well, if you look at patients across our system, the story about which way a patient is going to go typically happens in the first 3 to 5 days, where their oxygenation gets worse and worse. They may get these medicines like the corticosteroids, but they still are getting tired of breathing on their own and need the additional help of mechanical ventilation. Regardless of where that happens, if it happens in the community hospital or the big hospital in Springfield, that then gets them into the ICU, and oftentimes it's a several-week siege at that point. The 17, by the way, there are 2 in the ICU at Bay State Franklin, so it's not all in Springfield. But they really could come from anywhere, and it's really not until you see which way the case is going to go 3 to 5 days in that you know who's going to be requiring the ICU support.
And on the data recently about the vaccine especially if you're dealing with older or frail people, it doesn't always seem like we're getting that separation when we hear things like
Yeah,
that.
no, I think that's a good point. We do try to separate it when we list causes of death, but when you're looking at a huge study like that, you're looking at what individual doctors wrote down on the death certificate. So, as I recall in that study, there were 77 million people vaccinated and roughly 70 died of COVID, supposedly, after that, so 1 in a million. And the key, the thing that makes it tricky is that COVID can cause things like clotting problems. So a person who died of a heart attack or a stroke or a couple of weeks after COVID, was COVID implicated or not? A doctor might put COVID on the death certificate. So it ends up being difficult sorting that all out, I think. But just the same, even with the sort of lumping together or putting COVID on cases that died that maybe weren't due to COVID, that's still a very, very low rate.
Any other questions or comments?
Just a quick follow-up on this question on the ICU. Are you, in critical care, are you seeing an increase in the younger unvaccinated people that are ending up in critical care?
Yes, we are seeing younger individuals. Many times they might have a comorbidity. They might be obese, they might be diabetic, etc. But there are individuals who are otherwise apparently healthy that can wind up requiring critical care. And you know, because this is somewhat still a mysterious disease, there's nothing that's 100% about it. You can say that older individuals are more likely to get sick, more likely to require critical care, but that doesn't mean you never see it in younger individuals.
One of the things I've heard is sometimes younger people put off going to the hospital, that's why they might end up in the ICU if they have COVID more quickly. What advice would you give people to be on the lookout for symptoms that might say it's time to see, hospital or urgent medical care with or without a COVID diagnosis?
Yeah, I think that people who have flu-like symptoms, that is the clue, of course, that you might have COVID. So fevers, chills, aches, tiredness, the usual things that you might get with a flu, a cough, etc. That is your signal that you ought to slow down, go to bed, get yourself tested to see if indeed you've got COVID. The things that would mean time to get to the hospital would be if you're having troubles with breathing. I would advocate that anybody, that people might want to invest in one of those little $20 pulse oximeters that you put on your finger that measures your oxygen pressure so that you can tell if it's declining. And that would also be a warning sign that you need to get to an emergency room to be evaluated.
Any other questions or comments? Okay, hearing of Dr. Fairwell, thank you very much.
Pleasure.
Just before I bring Helen up, I neglected, she'll go a little more into it, but we did have some new deaths, 7, and again, our thoughts, prayers, and sympathy and encouragement go out to the affected families. That brings our total deaths to 246, 99 which are of white, 40.2%, 55 which are black, 22.3%, 85 which are Hispanic, 34.5%, and 7 Asian, 2.8%. Again, the long-term care facilities have stayed very stagnant, which is good, 60. The increase was in residential, 186. And just piggybacking off that and speaking with Bishop Byrne yesterday, we are working on, he wants to do an outdoor mass at Forest Park. He's working with Patrick Sullivan on 2 fronts to thank our first responders and in healing pertaining to COVID-19 with the losses of life that we have faced. Without further ado, I'm going to bring up the Commissioner of Health and Human Services, Helen Carlton-Harris. I'm deeply appreciative of her and her team's continued efforts. Helen Carlton-Harris.
Thank you, Mayor Sarno. The update for today, April the 27th, as the mayor said, our cases are 21,388. By day, Sunday, 73, Monday, 56, Tuesday, 55, Wednesday, 86, Thursday, 49, Friday 83, and Saturday 102. The cases by age 0 to 10, 64, 11 to 20, 112, 21 to 30, 83, 31 to 40, 86, 41 to 50, 57, 51 to 60, 63, 61 to 70, 28, 71 to 80, 7, 81 to 92, 91 to 102. Cases by age group, 30 and under is 52%, 31 to 50, 28%, 51 and older, 20% of the cases. There was a 5% shift in our cases from last week. The 30 and under group went down by 5%, and the 51 and older group went up by 5%. The cases by zip code, 01, 4, 1%, 03, 10, 2%, 04, 13%, 05, 45, 9%, 07, 45, 9%, 08, 81, 16%, 09, 133, 26%, 18, 31, 6%, 19, 39, 8%, 28, 2, which is 0%, and 29, 14, 3%, 51, 33, 7%. The cases for the last 6 weeks: March 14, 310, March 21st, 546, March 28, 486, April 4th, 521, April 11th, 548, and this week, April 18th, 504. We had a decrease of 44 cases this week over last week. As the mayor indicated, we have experienced deaths in our community. These deaths happened over a period from March the 29th, 2021 to April the 14th, 2021. A 63-year-old Hispanic female, a 63-year-old Hispanic male, an 83-year-old black female, a 78-year-old black female, a 84-year-old black female, a 75-year-old white male, a 59-year-old Hispanic female. And as the mayor indicated, certainly our thoughts and our prayers go out to each one of those families. We understand the devastation of a loss in a family at any age. The mayor indicated or talked about the clinic that we had on Saturday. The Interfaith Clinic at St. John's Congregational Church was very successful. I'm going to take a minute to thank those pastors who provided volunteers. They were just so committed to making this clinic a success. Bethel AME Church, Pastor Marcus McCullum. Celestial Praise, Pastor Dobbin. Deliverance Center Church of God in Christ, Pastors Mark and Janetta Bayman. Muslim Mosque Community in Springfield, Dr. Kamal Ali. Holy Trinity Church of God in Christ, Pastor J.P. Morgan. Iglesias de Dos Pentecostal, Pastor Ramon Arce. Odres Nuevos, Reverend Elsie Sanchez. Restoration Worship Center, Pastor Serrano. Solid Rock, Bishop Curtis L. Scher, Pastor. St. John's Congregational Church, represented by Deacon Wesley Days. TMC, Pastor Paul Medina. Wesley United Methodist Church, Pastor Catherine Cummings. Want to say thank you to each and every one of you. That was 12 churches that worked with the Vax Force with the Interfaith Clinic, and it was done very well. Other thank yous go to Dr. Sarah McAdoo and her PERCH students at the University of Massachusetts, Western New England College School of Pharmacy, Dr. Madison, Jose Claudio, New North Citizens Council, had many volunteers there. There were many individuals who came, stayed. We were there for a good part of the day, and we're really excited about being able to get vaccinated. Last week, we did second doses in 5 places. Tuesday at St. John's Congregational Church, Thursday at the South End Community Center, Friday at Harena School. BHN did second doses as well. Saturday, second doses at Bolin. And we did, as you just heard, the first dose clinic at St. John's Saturday. Our PSAs, our public campaign to help get individuals motivated to be vaccinated will drop this week. Our campaign is I Want a Shot at, and those PSAs will go live this week. I want to thank Springfield Public School Athletic Director Dwayne Early, who organized some students with us to do PSAs, and that's important because we do want to target younger people. So those PSAs will drop. Our billboards will also be going up shortly. This is an all-out effort to reduce vaccine hesitancy. Vaccine distribution, or those individuals who are getting shots in arms, are dropping nationally. So we want to make sure, at least in our area, that we are absolutely paying attention. Everyone can get vaccinated over the age of 16. Now, we usually have Moderna, and that's over the age of 18. I just want to reiterate that because we did have some 16 and 17-year-olds show up on Saturday, and we were not able to vaccinate them because we are using Moderna. I anticipate that we will be standing up a clinic with J&J doses this Friday at Greenleaf if the building is ready, but that link will be up on our website when we make the final decision. So we are moving towards, as the mayor said, the neighborhood clinics and trying to put clinics in places where we believe the residents are anxious and wanting and needing vaccine. I want to just say kudos and thank you to Friends of the Homeless. There was a scientific paper in the American Journal of Public Health Review that worked with urban homeless shelters, and it talked about best practices. And the City of Springfield, Friends of the Homeless, the Rescue Mission, put those best practices in place even prior to knowing that they were best practices. For example, having individuals sleep head to toe, making sure that there was the physical distance. Though we did have a slight outbreak, it's a very small outbreak in our homeless centers, for the most part, those numbers have nowhere neared other parts of the state. So we are very appreciative of Friends of the Homeless and our partners who are doing an excellent job of keeping individuals safe. We continue to test at Friends of the Homeless. We did get a grant that allows us to do testing, and so AMR is there, and they are testing those individuals in that environment as well. So we just want to say thank you. We look forward to opening up more clinics. We expect that that will continue to happen. The mayor has made a neighborhood commitment, and we're following through, making sure that we have sites that are safe. You cannot just put a clinic, or let me say, the City of Springfield will not just put a clinic in any facility without understanding that it is set up to be able to receive individuals, that it is safe as far as the airflow is concerned, and that there is sufficient space. So we'll continue to scout those out. Lastly, I want to thank Dr. Sly Douglas from Curative, who has been working very hard. He accommodated the city by opening up that neighborhood site, which is on the corner, it's home housing. It's on the corner of Bay Street and Oak Grove Avenue. They're doing a great job of getting individuals vaccinated as well. In speaking with him last night, we are going to work together to try to make sure we're getting the J&J doses out there and in arms as soon as possible. Right now, the city of Springfield has 1,100 doses of J&J. It was on pause. We are now able to use them, so we will be setting those clinics up shortly. Thank you very much, Mayor.
Thank you, Helen. And again, as Commissioner Colton-Harris indicated and Dr. Kerouac reinforced, we're using data, and these targeted neighborhoods really many a times go to the African American or Latino community to break hesitancy of taking the vaccine. The PSAs will be coming out shortly to reflect the community, to give them confidence to take the photo shot, any and all, on it. And also, I know, Helen, we're working on social influencers too on that. But the St. John's, again, was with all the residents.
AMR.
Oh, sure. AMR on the testing. Thank you, Helen. This is like the Oscars, and the Oscars has tested, and Patrick Leonardo, Director of Operations, is here. They have tested nearly 200,000 people, regional area, 188,331. Springfield, nearly 84,000. Springfield residents, 83,058. And positives of that, out of the 188,331 were 17,236. So the AMR, again, and Patrick Leonardo, Director of Operations, we thank you very, very much. So again, with Helen, on neighborhood clinics, we've keyed in on where low vaccination rates or hesitancy is, and we're hammering away on that, but we're starting to expand in other areas of the Springfield area. So appreciate Helen's and her team's efforts. With that, I'm going to bring up the Superintendent of Schools, Daniel Warwick, and his team have done a great job and a lot of good things going on moving forward. So I'm just waiting for the superintendent. I think he was doing an interview. Superintendent Dan Warwick will be coming up shortly. He has a lot of updates for you. The reopenings have gone very, very well. And again, the exciting news that being able to do high school graduation. So without further ado, the Superintendent of Springfield Public Schools, Dan Warwick.
Thanks, Mayor. Morning, everyone. An update on our meals program. We've kept the program going even though we've reopened schools for the families that are remote. And we've, year to date, since we closed down last March 12th, provided families with 7,176,407 meals. This weekend alone, 59,261. So we're keeping that program going. Right now it's at 11 sites, and we're going 4 to 6. When we come back to school full, we'll probably go down to fewer sites, but we'll again keep offering the program, and we'll have an offering in every major neighborhood in the city. DESE, COVID positive numbers. We have reports from 2 different week periods, 4/5 to 4/9. We had 27 students and 8 staff. 4/12 to 4/15, we had 49 students and 8 staff. Remember, that's out of 25,000 students and 5,000 staff, so the numbers have been low so far. The next report, the DESE report, will be 4/15 to 4/28 due to the vacation week. School reopening, we started grades 7 and 8 today in a hybrid manner. On May 3rd, we're going to have pre-K to 5 go from hybrid to full opening. And on May 10th, grades 6 to 8, all of our middle schools, are going to go from hybrid to full opening. High school, we don't have a final date, but I'm expecting one this week, and I expect a full reopening in May. And again, we'll get you the date as soon as the commissioner comes out with it. Fall 2 sports were a big success, and again, thanks to our health commissioner and all the testing that we did. And we're starting our spring sports, and the testing has been very, very positive. We only have 1 case, and we're able to go forward with that. We're planning our graduations live this year, according to our normal schedule, 2 weeks in June, but we're going to offer them at Central Field because we have outdoor facilities were highly recommended by DESE due to the COVID restrictions. So we're going to be able to have them on our normal schedule, and something I think our students and families will really appreciate. Mcas, there have been some changes in Mcas, not as many as were advocated for by some groups, but our current 11th grade students do not need the Mcas for their CD, so they'll be able to graduate without it. And some of the other changes are grades 3 to 8 students who are learning remotely can take the test remotely if they so choose. And they extended the schedule on MCAS to make it easier to complete the testing. That's all I have. Thanks, Mayor.
Thank you, Superintendent Warwick. We'll now go to the public safety component of this COVID-19 city and hospital update. I'll bring up the police commissioner of the city of Springfield, Police Commissioner Cheryl Clapper.
Thank you, Mayor. Good morning. The police department, as of today, has one officer out with COVID. We had a pretty decent weekend. We continue to work with the Sheriff's Department and patrolling Forest Park to make sure that's a safe, nice venue for the residents of the city to go visit. It was busy over the weekend, but there were no incidents at all. We haven't taken our eye off of the dirt bike problems. We are keeping a lid on that for our city, and then some of our neighboring and surrounding communities experienced an uptick. So we are meeting with some of the local police departments in our area, and we're going to put a joint push on that issue. I joined the mayor in commending and recognizing officers Jose Cruz, Francisco Luna, and Luis Delgado on saving the 3-month-old baby. I think they exemplify the dedication and professionalism of every officer in the Springfield Police Department if put in the same circumstance. Thank you, Mayor.
Thank you, Commissioner. And again, pinch hitting for Fire Commissioner Bernard B.J. Cali is Deputy, Fire Deputy Hess, Mike Hess. Want to come up briefly? Deputy Hess.
Thank you, Mayor. Good morning, everyone. It's been a relatively quiet week for the fire department. No major incidents, no major structure fires. Currently, as the mayor stated, we have 0 members out with COVID, and we're at a 40% vaccination rate as of today. So that's an approximate number. About 40% of our members are vaccinated. And that's all I have to report this week.
Thank you.
Thanks.
Thank you, Deputy Hess. Thanks, Mike. We'll now get an update from the Department of Public Works pinch hitting for Director Chris Signoli, the Deputy Director Greg Superno. Greg?
Thank you, Mayor. Currently, the Department of Public Works does not have any employees out infected with the COVID virus. Our springtime pothole program is in full effect, so if you do see any potholes, please report them to 311. Also, our paving projects are moving forward on schedule, and if you have any problems with your yard waste or any of our upcoming household hazardous waste events, for information on those, please contact 311 as well. Thank you.
Thank you. Thank you, Deputy Superintendent. And the traffic projects this weekend, again, the work that's being done in the Central Street corridor is tremendous. The reconfiguration that is going full-fledged there, so we're very appreciative of that, Deputy Superintendent Greg. Pat Sullivan, again, is he's covering a grant thing for me right now. We got his report. Now, the Chief Development Officer of the City of Springfield, again, we're in the business of doing business, Tim Sheehan.
Thank you, Mayor. As the Mayor indicated, Development Services has 0 staff out with COVID. Last week, the metro unemployment rate fell to 6.7% from 7.3%. That's the lowest since the pandemic began. There were 2 responses to the direct technical assistance to businesses, New North Community Center and Valley Ventures Mentors, VVM. We will be reviewing those responses this week. The third-party outreach to businesses is critical to ensuring that our deployment of small business assistance resources are aligned with the needs on the ground. And I'm pleased to indicate that Fort Street work has begun last week to advance and improve the outdoor dining on Fort Street. So my understanding is that it's got about a week left for completion. Thank you.
That outdoor dining work also includes the Worthington Street area on that. I gave you the brief update that Solicitor Ed Pakula and HR Labor Director Attorney Bill Mahoney. You received a financial update from my CAFO TJ Plant. So at this point in time, we'll take any questions or comments you might have of my cabinet heads or myself. Yes, Paul?
Good. I have questions for Commissioner Colton Harris.
Sure. Helen? Commissioner Colton Harris, please. Thank you, Helen.
Yes.
Commissioner, you said you did the second shots at the neighborhood location last week. Was there any problem getting people to come back for the second shots? There were reports nationally over this weekend that about 5 million people just didn't show up for a second shot. What was the experience in Springfield?
So the nationwide, they're reporting 8% are not showing up. Our percentage at this point was 2.5% or so. So we were not at the level that the national experience is.
What do you do with those people who don't show? Is there some follow-up maybe to try to get them to take a second shot?
Once we know that an individual has not shown up for the second shot, a telephone call and an email is sent to that person. So it's important for us to follow up. There could be many reasons, so we do that outreach.
Given the success of the interfaith vaccination drive this past weekend, and planning to do it again, I mean, after you do the second dose, obviously.
We do not have immediate plans to do an interfaith vaccination clinic again, but we do have plans to work with those churches to make sure that around their neighborhoods and where their houses of worship are located, that they're able to outreach and perhaps get those individuals to come in.
You mentioned that you have about 1,000 doses of the J&J vaccine that's been waiting for the pause to be lifted, which has been. How are you planning to use the J&J? I know some people talk about using it using it in mobile clinics, using it for homebound, where it would be easier just to do one shot as opposed to try to schedule second vaccination shot.
So as I said, we have 1,100 doses, and I am looking at standing up a J&J dose clinic only at Greenleaf this Friday once I get facility clearance. I am also working with Curative, Dr. Sly Douglas, to figure out how we can perhaps transfer some of those doses over to the site where he is, Home City Housing. Curative did take 500 of the J&J doses for us the last time, and so we're working to think about how we can work together, get those doses in arms. So we are trying to develop a strategy. The expiration date for those doses is June 21st and June 23rd. So I've got a little bit of time, hopefully, to organize and make sure we're being effective with our strategies. But we will stand up clinics to get those doses in arms. The congregate care settings have been the most interested in being able to use J&J because of the one and done, and they don't have to chase individuals or worry about individuals coming back for that second dose.
And just a question, Pat's not here today, but issues come up about the basketball pools in the parks. Can you address that issue, and what are the health criteria that you're looking at to determine when the pools can be put back up?
The city of Springfield is a red city, as you are aware. Basketball, by the state's guidance, is considered a high-risk sport. There's also the more transmissible variant that is out into the public. And so the fact of keeping the hoops down really is not punitive. I worry about our young people. I want them to be safe. And although it's important that the exercise happens, it's also important that we know that 85% of our cases last week were under the age of 50, and then 57% were under the age of 30. And so what we know is that this highly transmissible variant is out there. We are a red city. We know that it's a high-risk activity. We did allow basketball to move forward in Springfield Public Schools. That's because we put strict guidelines in place to make sure that that happened, as well as having the students tested. The coaches were very vigilant about making sure that the separation stayed in place, and we had little to no transmission during that season. When you're on a basketball court, there's no supervision. People are going to be skin to skin, chest to chest. That's really concerning for me with our young people. I'm worried about our young people's health, and that strategy that we put in place right now is something we're going to move forward with. If and when the city of Springfield returns to yellow, then I think we certainly can consider putting the hoops back up. But again, I just want to make the point, it's not punitive. Not trying to keep young people from not being able to be on those courts. I just want them to do it in the safest way possible, and that's my job, and that's what I'm doing.
Commissioner, just a quick follow-up, what is perhaps I missed this before, but the strategy in terms of vaccinating the homeless, is there anything using this particular vaccine, or using particular clinics, or standing up clinics at the shelters? We know that there's been some efforts in other cities to target specifically this population.
The shelters in the city of Springfield have partnerships with various agencies and organizations that are vaccinating. We will be reaching out in terms of the J&J doses because that's where the interest has been for those settings. And so we will be trying to make sure that those individuals have the opportunity to access J&J.
Thanks, Matt, on that. Yes, and the J&J, again, one and done, very convenient. The homeless population is transient at time, so to get one and done would be essential. And Paul, nice tie, Paul, by the way. On the with the hoops, Commissioner Helen Carlton-Harris, again, has indicated where you've seen the uptick in COVID-19 infection significantly has been on 30 and under. That is unstructured. What occurred at Adams Park, again, and we had to take the backboards now because they broke the backboards. They broke the backboards. I share Helen's thoughts. I don't want to see any of our young people become ill. And maybe just as importantly, they take that virus back to their parents, mothers, fathers, grandmothers, grandfathers, other family members there. So once we get into a steady flow of knocking down into yellow, and in consultation with Commissioner Helen Carlton-Harris and Patrick Sullivan, our Facilities and Parks Director, we will relook at that. We're doing this for the health and safety of especially our young people. Basketball is a high contact sport. I don't think any one of those individuals, no matter what creed, color, or background, would want to be the responsibility of getting that COVID-19 and taking it home to a family member, especially an older family member. So this is not punitive in nature whatsoever. We're thinking of you. We want you to be okay. And again, what we've done structured with our hoop season, with Commissioner Helen Carlton-Harris, Superintendent Warwick, Assistant Superintendent Lydia Martinez, AD Dwayne Early, and Nurse Jeannie Clancy. Very structured. Helen, I think we were testing 3 times, am I correct? Structured. Coach, you said? No issues whatsoever, but that was structured. So to have these unstructured activities going on, which are much different than less physical sports that have been allowed under structure type aspects. So in no way, in which some of the media is depicting it, this is punitive. This is not punitive whatsoever. This is because we care about you, our young people, and our families. I don't think any young person would want to be responsible again for being, my grandmother caught it. My grandfather caught it from me. My mother or father. It's in the stats. 50-something%, 30 and under. You tack in 50 and under, it's hovering near 80%. So once we continue to defeat this COVID-19, we will relook at that situation. But again, on the Adams Park, which was a park that Commissioner Clapper and I and Pat Sullivan worked with Nancy Lederman, a Hall of Fame basketball player, Police Community Relations Park, beautiful court we put up there. They broke the backboards. They broke the backboards. So that's the reasoning why those backboards are down, because they're going to have to be repaired when we're able to put the backboards and rims back up. Any other questions or comments? Yes, Eric. Yes, Commissioner Carlton here.
What would you say to a Springfield resident who still hasn't been getting vaccinated?
It is critical that Springfield residents be vaccinated. When we look at the data as far as vaccination is concerned, we understand that vaccines work, and we really want all of our residents to consider being vaccinated. I am not giving mandates, but I am saying that the way out of this pandemic is vaccination, and the way to get to our economic recovery is vaccination. So I'm encouraging all of our residents, please, if you have an opportunity, get vaccinated and use whatever vaccine is available. Please.
Now, a follow-up question is, if someone wants to get vaccinated, but their resident wants to get a J&J, what do you tell them?
The risk versus the benefit. If you look at the data regarding J&J, it is less risky, as Dr. Kerouac said, than being struck by lightning. And so we would encourage individuals to take whatever vaccine is available, including J&J, because the risk is very low, and the benefit means that the individual will be vaccinated against COVID-19, which is extremely highly contagious and can be and has been to over 540,000 Americans deadly.
Thank you, Commissioner. Thanks, Eric. Any other questions or comments? Matt? Yeah.
I want to make sure I heard that it's going to be 40% of the fire department vaccinated, is that correct?
That's the update that was given to me today, and again, we're going to continue to push for vaccinations on that. The protocols that they have taken, again, we're down to, I believe, 0 on it, but we still have stressed that the vaccines should be taken. That was an update that Deputy Hess gave me today.
And just kind of going back back 2 weeks ago, there was the issue with the NCDI and
Yes.
cooperation with
Yes.
DCF. I tried to follow up with the fire department after back. The DCF had said that the claims, was stated to me, that they take the safety was not seriously. They were waiting for the children in custody to get legal counsel or bill to protect the trash. Has there been any change in the situation? Has there been any
I know that when that came up at that time, Commissioner Calley was very upset by that, and we did do a reach out on it to get cooperation on it. I don't have an update on that. Deputy Hess has an update on that, but we're going to continue to pursue that. Two reasons here, Matt. I'm glad you brought it up. Now, the demo, the internal work is starting with MCDI, but we don't want to see a firefighter, a police officer, neighborhood resident, or even the young arsonist themselves, he or she, getting hurt in there. Number two, if you're under DCF care, that means they're with a family somewhere. If they have that firebug aspect in them, God forbid, they could cause a situation at that home or that family they're with. So I know that Commissioner Calvin and Deputy Hess will continue to pursue that. We know who, if I correct Deputy Hess, we know, if you want to come up, we know who the culprits are, but I'll give it to Deputy, if he can give, if we're able to say anything within reason, because it is still an investigation.
The latest update I got this morning is that the juvenile of interest has an attorney representing them, and we haven't been able to talk with that person. So we're still, nothing has really changed.
So the impediment would be, Barrett's right to remain silent to legal counsel at this point. It's not DCF standing in the way between.
As far as I know, with the update I got this morning, it's not DCF in the way right now. Okay.
Thank you. Thanks for that update. Any other questions or comments at all? Okay, hearing none. Again, I'm very appreciative of the media, TV, print, and radio for continuing to get this pertinent information out to Springfield residents and our Springfield business community, and really to surrounding areas of Western Massachusetts. We appreciate that. I want to thank again you, the Springfield residents and the business community, for your patience, your understanding, and your cooperation. We are getting there. We will defeat this COVID-19, but we still are in the red, technically in the red. So that means we need to follow public health protocols and guidelines pertaining to medical and pertaining to the sciences. So that means, mask wearing is still essential to do that, especially when you're in public areas. The other thing, and Dr. Kerouac has stressed it to you, Commissioner Helen Colton Harris has stressed it to you, and even last week with Dr. Robert Roos stressing it to you. Please, please, please. The availability of getting a vaccine shot is there. We need you to take those shots, whether it's Pfizer, Moderna, or the one-and-done deal, J&J. You saw the percentage of that. For something to happen to you to be struck by lightning, minuscule. So the sooner that we can get more shots in the arms, shots in the arms, shots in the arms, and we're going to continue to do that through Curative, the mass vaccination site at Eastfield Mall, but even more importantly, Helen and I will continue to do it in neighborhood sites. The quicker we do that, the quicker we're going to be able to take these masks off. The quicker we're going to be able to put those basketball hoops back up. The quicker we're going to be able to give hugs. The quicker we're going to be able to get together and be with family members and friends to celebrate during events. The quicker we're going to be able to open up even more our economy. So please, we're going to continue to get information out there on any hesitancy of taking this vaccine. These conspiracy theories, again, do not solve medical challenges. Vaccines do, and you can think about all the other vaccines that have come along that have taken care of once deadly medical challenges of years and years ago. So, to each and every one of you, good health to you and your families. Go out and have a great day, and God bless. Thank you very much.